Is Omicron the end of the pandemic and the start of an endemic state of COVID-19? Now, that is the question in today's panel discussion. And to answer it, I have Dr. David Quark at Soonchunang University Hospital live on the line. Dr. Quark, welcome back.
Good afternoon, Sunny.
I also have Dr. Angelique Coetzee, who is part of the team that first detected Omicron over in South Africa. Dr. Coetzee, it's a pleasure to speak with you again.
Thank you so much. Good morning.
Right. Meanwhile, over in the Netherlands, I have Ingrid Herkhammer, a freelance journalist, live on the line also. Ingrid, thank you for making the time to join us live.
Hi, Sunny. Good morning.
Right. Dr. Quark, we'll start with you then. Let's begin with your thoughts on the traits of Omicron that indicate a possible transition into an endemic state of this pandemic.
Right. So to do that, I think we need to clearly define the difference between endemic and the pandemic. Endemic still means that we will be having this virus going on locally, but it'll be to the point that it is not a global threat. As opposed to the pandemic, as we experienced in the past couple of years, pandemic is the global threat, which spreads very quickly, but also causing high mortality. So in the sense that endemic is a local, manageable type of a virus, since we're seeing Omicron to be yielding much lower severity rate as well as the fatality rate, we're hopefully foreseeing the phase to go to the step of it being endemic. If I may bring up some numbers, currently Omicron severe cases rate and fatality rate is marked at around 0.42% and 0.15%, which is much lower than that of the Delta, 0.8%. And as we will probably talk about a few minutes later, it is becoming quite comparable to the numbers that we would have seen from influenza virus. But not only that, on top of that, the fact that we also have treatment regimen, which can block in its replication inside the human body, on top of also the vaccination, which is clearly shown to reduce the rate of mortality as well as the severity. We believe that through the Omicron phases, we're becoming very near to the phase of endemic currently.
Right. Dr. Coetzee, as I mentioned earlier, you were part of the team, of course, that discovered Omicron in South Africa late last year. Would you say Omicron is paving a path out of the pandemic over there in South Africa as we speak?
That's a very interesting question. If we look at our South African data, it is clear from the past 2 years, we had 4 waves. In between those waves, we've got what I call a 3 months grace period. So we are now moving into our grace period, and if we would, according to the stats, get us a 5th wave, it would be around May, June. So to answer your question, if we don't see a 5th wave around May, June, as per the past 2 years pattern or trend, we might be going into an endemic state or phase. However, if we again see either a new variant or a wave with maybe one of the previous variants, it's still going to be difficult to say where we are in the pandemic going forward. So I think the short answer is within the next 6 months, we would know whether we're really going into the endemic phase or not. And looking at the data, especially in South Africa, it's easy because we're not a big country, and our data is quite nicely projected. And we look at that and see. We all hope that we're going into an endemic phase, but it's still a bit early times. As I said, next 6 months will tell us.
Right, I see. So we'd have to wait until May or June then. Meanwhile, over in the Netherlands, Ingrid, the Netherlands is poised to lift all pandemic-related restrictions come Friday as authorities adopt a new normal amid COVID-19. First then, what can you tell us about the COVID-19 situation there, Ingrid?
Yeah, Sunny, it's going really well, actually. The Dutch Institute for Public Health and the Environment reported around 300,000 positive tests last week. That is a 37% fall, which is great. there is only around 1,600 people in hospital with COVID, with 171 currently in intensive care. That's also a huge reduction. To give you an idea, current number of people in hospital is about half what it was at the peak in March 2020. And it seems to be mainly young people getting ill, and they are experiencing often very mild symptoms. So, yeah, it's going well.
Right, and given that scenario, Ingrid, starting from Friday then, are you expecting a complete return to life before COVID-19? I mean, do tell us a bit about the planned exit and the public's response, of course.
Yes, that's all slightly strange at the moment. It's now 2 years to the day that the Netherlands confirmed its first case of the coronavirus, and almost all restrictions are being lifted in 3 days' time. So currently that means our restaurants, our bars, our saunas, the hairdressers, they're all open again. We even have sports events, and in 2 days' time, actually, the coronavirus pass will be lifted, and people are allowed to take off their masks. Dutch citizens are extremely happy with this development. The bars are full. No one is wearing a mask anymore, and in 2 days' time, we also can leave the 1.5 meter social distancing. So, yeah.
Ingrid, what happens to the mask mandate then? Are you required to wear masks, or is that being lifted as well?
In 2 days, it's being lifted, yes. And this is causing a little bit of concern, particularly among the elderly population, where people are concerned about how to protect themselves. Now the rest of society kind of has given up and pretends that COVID is no longer amongst us.
Right. Dr. Quark, despite talk about Omicron being milder, recent US findings show its toll, especially in terms of fatality, appears to be higher than those of the Delta. What are your thoughts?
Right. I also saw that report that very recently the death toll from Omicron and its total numbers have surpassed what the Delta variant has caused. But we need to really statistically have a look at it in regards to the fatality rates at which these the case numbers cause. So from Delta variant, in the time period between August 1st to October 31st, there were about 10 million new cases found, yielding about 132,000 deaths. But if we compare that to the number of Omicron has yielded from November 24th and on, we have found about 30 million new cases, which yielded about 154,000 deaths. So in comparison, in total number of new cases found, it's about 3 times as much the Omicron is yielding against Delta, but roughly about the same to about 20% higher rate of deaths. Not rate, but higher number of deaths that was yielded from the Omicron. So in comparison, in its proportion, Omicron is clearly yielding much less fatality rate at this point. I can say that that is about a third of the amount, or quite possibly to about 1/4 of the amount, which if we start calculating our own numbers into this as well.
Right, and because precisely of the reality that Dr. Quark has mentioned, Dr. Coetzee, there are some who claim that they would choose to be infected with Omicron given the mild nature and the lower risk of fatality. How do you respond? Dr. Coetzee.
Good question. And they also raised that same in South Africa. So I will respond with caution. I would say it is difficult, especially if you are older, with comorbidities, overweight, not knowing whether you are healthy or not. And if you then intentionally get infected and not vaccinated, you can get yourself in big trouble. You might become a part of the stats, lying in ICU, and then part of the death stats. I don't think that's a good idea. I also need to agree with Dr. Quark regarding in South Africa, the death rate is as well 1/3 less with Omicron than with the other diseases. And again, we need to start to interrogate these stats very carefully in a way that anyone dying, if you had tested positive at some stage, they would just add it and giving the perception that everyone died from Omicron and not from the motor car accident, and Omicron was incidentally picked up. So I think we need to look at that. But you're very stupid if you start to get yourself infected, especially certain age groups and comorbidities. You should not do that.
Right. Meanwhile,
rather get yourself vaccinated.
Right, so you need to be very cautious, of course. Meanwhile, Ingrid, what preparations perhaps are being made by authorities there to deal with a possible rebound in daily infections in the case of a new variant or any other unfortunate scenario?
That's a very good question. That's very unclear at the moment. Our Prime Minister has effectively said that the COVID is over and they're currently looking at a phase-out plan. It has not been communicated yet, but I think in the future we will know that very soon. I think it will not be including any strict lockdowns anymore. Particularly because the population here is definitely done with the pandemic. As you know, there have been very large protests for months in the Netherlands, but also in other European cities. And I think, it's very well understood that the citizens are done with the restrictions, that they find it very, very challenging at the moment. So we will have measures likely, but not to any degree, to the same extent that we had before.
Right. All right, Ingrid, thank you very much for the latest from the Netherlands, and do enjoy your newfound freedom away from pandemic restrictions.
Thank you so much.
Right, now back at the local front, Dr. Quark, findings show the vaccinated, as my colleague Soa mentioned, are clearly protected from severe COVID-19 and related fatality as compared to their unvaccinated counterparts. Tell us more about these findings.
Right. So for those who received their booster shot, namely their third shot, the Omicron's fatality marked around 0.08%, which is comparable to seasonal influenza's rate of death of in between 0.05 to about 0.1%. But it's still in those who did not receive any shots, still marked around above 0.5%, which is about 5 to 7 times that of the influenza virus. And also in the elderly group, age above 60 years of age, those who received their third shot showed fatality rate around 0.5%, but those who weren't vaccinated in that age group still marked that around 5.39%. So it clearly shows that vaccination is still probably the number one step that we need to take in protection against SARS-CoV-2 in its totalness. Whether that be for any variants, whether that be for Omicron or even Delta, or even possibly in the new upcoming variants if it was to happen. So I think, once again, we need to iterate ourselves, those especially who are vulnerable, such as those in the elderly age groups. And for those people who have, let's say, underlying diseases such as obesity and diabetes, and for those people who are bedridden and contain hospital, they definitely need to get vaccinated, let alone for those people who are even much younger generation who are worried about the situation. I strongly suggest that they should also choose to get vaccinated as well.
Right, and staying with vaccination, Dr. Coetzee, do you believe that inoculation needs to remain a priority even as we embrace an endemic state of COVID-19?
Yeah, I think so at this stage. I am, however, worried. What we are seeing is that the breakthrough infections due to the mutations. So, you know, and I know the people are going to pick up on this, and that's why I would like to raise it. It is true that you can still get Omicron if you're vaccinated. You can get Omicron if you had Delta before. We see that, and we see clearly in our daily engagements with the patient. If you have been vaccinated or had Delta, especially vaccinated with your last vaccination in October last year, you will have to unfortunately test anyone coming in then with an upper respiratory tract infection symptoms, because it seems that the vaccines last against the mild disease around about 4, maybe 6 months, all right? But, and here's the but, what we however see is that vaccinated people, even if it's still, they've been vaccinated 6 months ago, for argument's sake, when they get Omicron, for now, because we have stats on Omicron, remember South Africa didn't only started with our vaccination process in our Delta wave. Their symptoms mild. Look at our hospitalization, 80 plus, unvaccinated. So it's clear that your vaccines protect you against severe disease. It escapes mild detection. But even in your mild detection, if you get it, we have seen the symptoms are less intense than unvaccinated people. And so therein lies a thing, yes, we need to sort of carry on. We don't know what we're going to encounter going forward. We might encounter similar like Omicron, and that's fine, because then we know the vaccine or immune escape pattern. But we might encounter something severely worse, and we don't know. So that for now, your protection will be your vaccines. Even if you had, remember, previous Delta in South Africa, that's more than 6 months ago, you still can get Omicron. So we need to watch the T cell responses and your antibody response.
Right, because prevention is better than cure, of course. Dr. Quark, authorities here in the country claim that at the height of our Omicron peak, we may have as many as 1 million COVID-19 patients at home. How prepared is our medical arena for such a scenario, especially in the case of emergencies?
Right. So it seems like looking back from the steep jump in the home care numbers that jumped more than double through the past week or so, it is very likely that we're going to reach a very high of a number in those people who will be treated at home. And it seems like it's being reported that they're becoming more concerned about these cases where people who are at home cannot be transferred to hospitals right in time for their resuscitation in case their severity has gotten much worse in a very acute phase. But if we look at closely these cases, these are matters of minutes rather than hours or even days. So even if they were to have been monitored or taken care at a level up facilities, I think it would not have made that much of a difference in regards to unfortunately them passing away or still being contained in the ICU units. So for that matter, I think in this case, rather than enhancing the transfer methods as the government is planning on doing, I think there needs to be a step taken where we can closer monitor these patients as in a medical facility instead of their home care system, so that if something was to happen to them, if their condition changed suddenly and drastically, a medical person can directly start treatment on them. So in order to do that, we obviously need to enlarge the numbers of containment facilities, but that is quite limited in our situation where we have limited numbers of ICU beds, even though the government is claiming that we have up to about 2,000 capacity. So I think, so as an alternative, I think we can still utilize the social facilities by deploying more medical personnel to those places, so that when they are there, they're not there to just monitor these people, but when in need, they could actually go ahead with the treatment and even intubate them if it's needed at the care facility.
Right. And Dr. Coetzee, as a medical expert who has observed and studied Omicron's emergence and subsequent exit, if I may say so, what are your thoughts on Korea's efforts to fight it, very briefly speaking?
Yeah, South Africa got a different healthcare system. You can actually easily treat these patients at home. They're not really very sick. It's about 3 days for most of the symptoms. But the important thing is what we have learned. In Delta, you do not start with cortisone. You wait 7 days at least. Omicron, immediately, when you make the diagnosis, start with cortisone, 5-day course. And you will see a drop in cases regarding side effects. You do not need very expensive medication. And like I've said, it's 4 days, 5 days. It is so easy to treat, but the longer you wait to put them on the prednisone or the cortisone, the more symptoms they get and or complaints. Immediately, it's easy, it's cheap, and you will get your patients out of hospital.
Right.
Very important. We need to start look at these type of things.
Right, so prompt treatment then.
Yes.
All right, Dr. Coetzee, as always, thank you very much for your insight today. And Dr. Quark, as always, thank you for your thoughts.